Hello everyone, we are from Group 8 and consisting of Adliah Wulan Sari, Putri Ayu Naibaho, Rahmah Fauziah, Fauziyyah, and Yashifa Akhamel Putri. We are students from the Faculty of Nursing Adliah University, and we will explain about diabetes mellitus. First, I'm Putri Ayu Naibaho, and I will explain about definition. Diabetes is a chronic metabolic disease that occurs as a result of the body's inability to produce insulin, or the body is said to be unable to use insulin effectively, so that there will be an increase in normal blood sugar level called hyperglycemia. Normal blood sugar level in the morning after overnight a person fast is 70 to 110 mg or deciliter, and diabetes consists of type 1 and type 2. I think that's all I can explain to Fauziyyah. Time is yours.
Okay, thank you Putri for you give me time to explain about what causes diabetes. Hi guys, let me introduce. My name is Sarah. I will explain for you about what causes of diabetes. Okay, diabetes mellitus have two types, type 1 and type 2. First, I will explain for you what causes type 1 diabetes mellitus. Okay, causes type 1 diabetes is usually heart disease and occur when your immune system, the body system for fighting infection, attacks and destroy the insulin producing beta cells of the pancreas. Scientists think type 1 diabetes is caused by genes and environmental factors such as virus that might trigger the disease. And next, what causes type 2 diabetes? Causes type 2 diabetes is lifestyle. The most common form of diabetes is caused by several factors, including lifestyle factor and genes. An example: overweight, obesity, and physical inactivity. You are more likely to develop type 2 diabetes if you are not physically active and are overweight or obese. Extra weight sometimes causes insulin resistance and is common in people with type 2 diabetes. The location of body fat also makes a difference. Extra belly fat is linked to insulin resistant type 2 diabetes and heart and blood vessel disease. So check out the body mass index or BMI chart. Okay, that's all from me. To Yashifa, this time for you.
Thanks, Sarah. Next, I will explain about sign and symptom of type 1 and 2 diabetes. That is increased thirst, frequent urination, hunger, fatigue, and blurred vision. 1. Increased thirst. The body is replenishing less fluid and managing high blood sugar. 2. Frequent urination. The body lost a lot of water due to high blood sugar. 3. Hunger. When blood sugar level drop, the body thinks it hasn't been fed and prefers the glucose that cell needs. 4. Fatigue. Occurs when cells don't enough glucose. 4. Blurred vision. Uncontrolled blood sugar level lead to nerve damage and bleeding in the blood vessel of the eye. I think that's all I can explain. To Rahmah, time is yours.
Okay, thank you Yashifa. Next, I will explain about medical and non-medical treatment for diabetes mellitus. For medical treatment, first, insulin therapy. One method to reduce blood sugar levels in people with diabetes mellitus quickly. The insulin dose at the start of administration is 10 units per day, or 0.2 unit kilogram BB, which can be given at the time before sleep or early morning. Next, metformin. Metformin works by increasing the work and activity of the hormone insulin, reducing the formation of blood sugar in the liver, and decreasing the absorption of sugar in the intestine. This way, overworking will help lower blood sugar levels. Metformin dose and direction. For adults, initial dose 500 until 850 mg to the 3 times daily. And for children aged 10 years and over, initial dose 500 until 850 mg once a day. Next, pioglitazone. Pioglitazone works by increasing the sensitivity of cell to insulin, so that more glucose or sugar can be processed and used by the body. This way, overworking will help lower blood sugar levels. Keep in mind that the drug is not used in the treatment of type 1 diabetes. Pioglitazone dose and direction. To treat type 2 diabetes mellitus, the dose of pioglitazone that is usually given by a doctor is as much 50 until 30 mg once a day. The dose can be increased if needed. The maximum dose is 45 mg per day. Next, for non-medical treatment. First, cinnamon. For ingredient, cinnamon 2 stick, 5 cm long each, and hot water 200 ml. For the step, brew cinnamon with hot water and drink while warm. Should drink the cinnamon step water twice a day to effectively lower blood sugar levels. 2. Cherry leaf. For ingredient, 102 g of fresh cherry leaf and 1 liter water. For the step, wash the fresh cherry leaf, boil the cherry leaf until the leaf 500 ml of water, and cool the boiled water cherry leaf. Okay, I think that's all I can explain. For Adliah, time it's yours.
Okay, thank you Rahmah. So the next I will explain about the prevention of diabetes. First, losing weight and keeping it off. Weight control is an important part of diabetes prevention. You may be able to prevent or delay diabetes by losing 5 until 10% of your current body weight. And once you lose your weight, it's important to don't gain it back. Okay, the second is following a healthy eating plan. It's important to reduce the amount of calories you eat and drink every day. Your diet should include smaller portion and less and fat, salt, and sugar. Fiber-rich food promote weight loss and lower the risk of diabetes. Eat a variety healthy fiber-rich food such as fruits such as tomatoes, peppers, and fruit from trees. Non-starchy vegetables such as leafy greens, broccoli, and cauliflower, and then legumes such as beans, chickpeas, and lentils, and then whole grains such as whole wheat pasta and bread, whole grain rice, whole oats, and quinoa. Okay, the third is getting regular exercise. Exercise has many benefits, including lose your body weight and also lowering your blood sugar levels. Try to get 30 minutes of physical activity 5 days a week. The fourth is optimizing vitamin D levels. When people who are deficient taking vitamin D supplements, the functions of insulin-producing cells improve, their blood sugar levels normalize, and the risk of diabetes reduces significantly. Good food sources of vitamin D include fatty fish and cod liver oil. In addition, sun exposure can increase vitamin D levels in the blood. 5. Minimizing intake of processed food. Studies suggest that cutting back on packaged food that are high in vegetable oils, refined grains, and additives may help to reduce the risk of diabetes. 6.
Avoiding smoking. Smoke can contribute to insulin resistance. If you already smoke, try to quit. Okay, I think that's all can be delivered to you. I'm sorry for all of our mistakes and I hope this information can be useful for you. Assalamualaikum warahmatullahi wabarakatuh.